As a physician, here's how I'm thinking about the newest obesity medication. I'm Dr. Alta-Peter, board certified in obesity medicine. So last week, FDA approved Foundayo, providing yet another option for medical therapy to treat the chronic disease of obesity. This brings the total up to 8 FDA-approved prescription medications for chronic weight management. And honestly, this is great news. The more options, the better, because the truth is that patients are so individual, and what works for one person may not work for another. So more options are better. So here are the highlights. Foundayo is an oral small molecule GLP-1 receptor agonist. So it works on the same pathway, the GLP-1 pathway, as some of the other medications like semaglutide and tirzepatide, but through a slightly different mechanism. One key difference between a small molecule and a peptide medication is how easy it is to give orally. So in this case, it's a once-a-day tablet you take by mouth, and you can take it any time of day, with or without food, without its absorption really being affected. And so that's great. This is a little bit different than the oral semaglutide or oral Wegovy, which was approved just earlier this year. For that one, because it's a peptide medication, you have to take it with very specific conditions on an empty stomach with no more than 4 ounces of water, and then you have to wait at least 30 minutes before you can take anything else. And so, this difference in how it's administered might make a difference to some patients in terms of how easy it is to take it correctly and consistently. In terms of outcomes for patients, the participants in the trial lost an average of 11% of their body weight, which worked out to be about 25 pounds. And although we have to be careful in making direct comparisons between one study and another, in general, we can say that this is on par or fairly similar to what was observed with the oral semaglutide trials, and a little bit less than what you could expect from the injectable medications. It's also important to remember that this is an average across the whole trial population, which means some patients lost less and some had significantly greater weight loss than that 11%. Safety-wise, the side effects were very similar to other GLP-1 medications and consistent with what we would generally expect. Far and away, the most common things are related to the GI tract, so things like nausea, vomiting, constipation, abdominal pain, bloating. These are the most common things that patients experience. And in this trial, they were very common. More than 60% of participants who received Foundayo, regardless of dose, reported one or more GI-related side effects. That being said, they varied in severity, and only about 8% of patients in the trial actually needed to stop taking the medication early because of their side effects. So to summarize, Foundayo is the latest medication approved by the FDA for the treatment of chronic weight management, and it gives us another option to help patients who are living with obesity or overweight and seeking medical help to lose weight. If you have more questions about this topic, I would love to address them. You can leave them for me in the comments below. Thanks.